More than 5 times as many people across the state of Wisconsin have tested positive for pertussis, also known as whooping cough, this year in comparison to the same time last year. Fortunately, doctors say there are a number of ways to protect yourself beforehand and even after you catch it.
We're seeing an outbreak of pertussis that actually started back in April, which is a little bit unusual.
Dr. Thomas Huffer says he's noticing a different trend this year when it comes to patients testing positive for whooping cough.
Usually pertussis is most common in August, September, and October. So we expect to see an uptick this time of the year, but it's been a little bit more extended this year because it started early.
Nationally, there are 3 times as many cases so far this year compared to the same time last year. In Wisconsin, there are 278 cases confirmed so far this year, compared to 51 at the same point in 2023. Statewide, at least 29 counties are reporting at least 1 case so far this year. And even though Dr. Huffer says it can affect everyone, his biggest concern is protecting children.
It's always kind of scary when we see an infant with pertussis, for sure, because they do get pretty sick.
Fortunately, Dr. Huffer says there are steps you can take to protect yourself.
If you know you've been exposed, that's one of those times where you definitely need to go see your doctor, because there are antibiotics that we can give to people who have a known exposure to whooping.
Now, Dr. Huffer says the best way to really protect yourself is to get the Tdap booster about every 10 years after initially being vaccinated, even though here in Wisconsin we've experienced nearly 5 times as many cases of pertussis, also known as whooping cough, in comparison to the same time last year. There have fortunately been no deaths so far. Reporting from St. Vincent Children's Hospital in Green Bay, McLeod Hageman, NBC 26.